Integration has become an important consideration and part of our work, largely on the heels of our participation in both the education and the health mobilization processes. United Way of Central Ohio was fortunate to be engaged in both education and health mobilization and had really formative experiences in partnership with United Way Worldwide and other peer United Ways throughout the network. And our involvement in both had a really an important influence on our work. And so the invitation to engage with other peers around the United Way network as part of the education, income, and health integration planning process seemed to be a natural progression or a natural evolution. At the same time, it also came in the midst of two other important processes that we were engaged in here at United Way of Central Ohio between around 2013 and 2014. And those were our board and our organization's engagement with a strategic planning process that took place during 2013 and 2014. The evolution, or sort of the growth to a more enhanced model, to one of the key parts of our organization's work, early learning and education initiative called Columbus Kids. And so integration was a key part of those processes because we were looking to move from one strategic framework to another and to be able to evolve the way that we went about developing resources to support our work, communicating and telling stories about the way that we went about our work, and certainly to enhance the way that we went about our community impact work, all as a part of our strategic planning process. And so for a long time, we felt that we were focusing on the right priorities as part of our community impact work, doing that work well, but we also didn't feel as though we had the most unified framework of strategies to advance our education and our income and our health work. And so, not surprisingly, and I'm sure the experience is similar for other United Ways throughout the network, is that we felt that our work was still occurring in silos. And that was an important part of what we wanted to get underneath as part of our strategic planning process as an organization, certainly as a community impact department. So that was a nice alignment of activity and priorities with the work that we were doing for strategic planning and the opportunity to be engaged with the education, income, and health integration work. And I also mentioned another key initiative in our organization, and that's Columbus Kids. And again, the interest in ensuring that we were able to achieve sustainability and long-term success with Columbus Kids was another key priority of our organization, and a lot of the considerations associated with that were occurring at the same time as the opportunity to be involved in the integration work came along. And just to share a little bit of background about Columbus Kids, it's been an initiative that United Way of Central Ohio has been leading for about 5 years now. It's an early learning initiative, and its focus is to identify and screen young children and families to identify developmental needs and to be able to refer and connect those children and families to appropriate services if developmental needs are identified. And so the work has certainly scaled to be a community level initiative. The resources required to implement it certainly have scaled as well. And so to sustain those activities, United Way of Central Ohio was keenly interested in identifying solutions to ensure that Columbus Kids was able to be implemented for another 5 years and certainly beyond. The proposed Venn diagram developed by United Way of Central Ohio to outline our approach to integration of education, income, and health is comprised of two illustrations, and I'm going to share a little bit of background about each of those. I'll start with the slide that outlines the sort of the mechanism or the sweet spot for integration and share some of the components that are a part of that mechanism, and then I'll sort of zoom out to the broader Venn to show where that mechanism kind of lives in the integration of education, income, and health. And so on this slide, this is an illustration that outlines the Pathways Community Hub model. And for purposes of our approach to integration, this is what we view as the sweet spot for integration. It consists of a few different elements, and at the very center of it is the hub. And the hub it's an infrastructure that ideally would be the only of its type in a community. It is an administrative and an information technology infrastructure that's designed to be the central coordinating point for resources, funding that come from a variety of braided revenue sources that come in through the hub and are then coordinated and paid out through a variety of different contract partners. And the notion behind the Pathways Community Hub model is based on the experience of payers and community-based providers that a variety of needs exist on the part of individuals and families, ranging from housing to education to mental and behavioral health, and other needs. And resources are not always coordinated in such a way to ensure that the providers that can deliver the case management and the care coordination to ensure that individuals who have needs in those areas are able to connect to the resources and then have the infrastructure in place to be able to make effective referrals to the direct services or the intervention resources that can provide for individual and family needs. So this model is one that was introduced to United Way of Central Ohio by a few different partners, and it was based on the awareness that work that we were doing with our Columbus Kids initiative seemed very consistent with the logic behind the Pathways Community Hub model. And so what we're doing in Columbus Kids is primarily screening all children who are 2.5 through 4 years old in Columbus and Franklin County, using the Ages and Stages questionnaire and the Ages and Stages social emotional questionnaire to determine whether those children have developmental needs that are going unmet, and then to simply refer those children to the appropriate providers to provide services and resources to meet those developmental needs. And so that's how we came to be introduced to the Pathways Community Hub model. And so it was our observation that this model and the potential roles that United Way of Central Ohio could play within it provided a significant value add to the work that we could do in conjunction with community partners, and certainly was a natural extension of some of the roles that we were already playing. So I'll sort of walk you through some of the elements of the hub. Obviously, resources are critical in this model. And so what it does is it creates the opportunity for a variety of different revenue streams and payment sources to be able to contribute resources with a specific intent to coordinate care, to case manage based on specific needs of individual populations. So you can see the role of the pathway funder. The hub, as I mentioned before, is primarily a data, an IT, and an administrative infrastructure that's meant to coordinate all care coordination and case management services occurring through the Pathways Community Hub model. We've customized it a bit, but the role that United Way of Central Ohio and our Columbus Kids team, and really more generally contract partners plays, is primarily to provide the case management and the care coordination services for a specific population of individuals and families. And so you can see the role of that particular component in this model. And then moving on to the role of the pathway. Pathways, as you see here, are a standardized set of protocols that are simply a sort of a step-by-step process that outline the activities that a care coordination provider or case management provider would need to deliver in a standard way. So if through a developmental screening, for example, it was determined that a developmental referral is needed for a child for fine motor skill development or social emotional development, that need would be identified through the screening, and a developmental referral pathway would be instigated. And so the care coordination provider, the case management provider could deliver a set of, or could move through a specific set of activities outlined on the pathway to be able to ensure that child was connected to the resource that he or she needed and the direct service was ultimately provided. That's just a quick outline of the elements that are incorporated into the Pathways Community Hub model. I will then sort of toggle to the sort of zoom out to the proposed United Way event and how this fits as our kind of primary mechanism for integration of education, income, health, and in our case, home as well. So you see the Pathways Community Hub model sort of lives here at the very center of the hub diagram. That's our sweet spot, or our mechanism for integration. Based on some of the defined pathways or the care coordination and case management protocols that are built into the Pathways Community Hub model, there are a number that are specifically focused on what we think are education-specific components. Likewise, for health-specific pathways, and in turn, similarly for income or financial stability or financial capability pathways. And so the idea in this model is that United Way of Central Ohio could potentially play three roles. We could play the role of a supporter or an operator of the hub infrastructure in our community through examples like our Columbus Kids Initiative. We could play the role of a care coordination or a case management provider, so we could actually be delivering service through specific pathways. And then a third role is that we could be a potential funder for both pathways, which essentially are a set of services that are focused primarily on care coordination and case management, connecting individuals and families to services based on need. And we could also play the role that we've historically played, which has been funder for direct services. And that's what we're using. That's what we are depicting here with these larger sort of pie slices on the outside circle that are kind of embedded behind the vent. So these are intended to reference direct services that are focused on education-related intervention, out-of-school programming, social emotional programming, or likewise with income-related interventions. So the idea is to depict that United Way can play a number of different roles in this Pathways Community Hub model, all of which could be natural enhancements to some of the work that we've done historically. Our entry point for this particular sweet spot or this mechanism for intervention, I spoke about it before, but it would be our Columbus Kids Initiative. And so that's a part of our work that has evolved to being implemented at the community level. You know, in a given year, we're working with anywhere between 12 and 13,000 children and families to conduct developmental screenings and make appropriate referrals based on need that comes from the Ages and Stages questionnaire. And so that would be the place where we would, in a sense, sort of build from a natural strength that we have at United Way of Central Ohio. So some of the workforce is essentially built in. Some of the work that would be required to occur in conjunction with pathway protocols is already happening, maybe not necessarily in as formal a way, but that work is already occurring. So that would be a place where we would probably enter into this integration model and to sort of build from a natural place of strength at United Way of Central Ohio. The population of Columbus Kids, which is largely a pre-K and early learning population. Right now it's 2.5 through 4 years of age, and the families and parents and caregivers of those children. So that would most likely be the population of individuals that we would focus on initially and probably build out as we activate pathways that are more health related or more income related, and bring in other contract partners to be able to provide additional services through the Pathways Community Hub model. Some of the key partners that we believe are inherent in this model would include certainly partners that have an interest in serving as payers or funders or investors to be able to provide resources that support care coordination or case management activity occurring through the hub. So naturally, some of our philanthropic partners, some of our corporate foundations, and over time, perhaps even influencing the investment of public resources that are also interested in achieving certain outcomes that can be achieved through the Pathways Community Hub model. Local school districts, Columbus City Schools, certainly the largest urban district in Franklin County, is a natural partner. Local city and county departments of public health, and certainly some of the health systems and hospital systems in our community would be natural partners based on their shared interest in scaling this type of integration model. And finally, the array of agency partners that we have a number of different partnerships, from funding to other community partnerships with our agency partners, are also natural contributors in this model. Many of them are already providing some of these case management and care coordination services, not to mention are also providing some of the direct services that would be the ultimate destination of individuals and families being referred for provision of intervention and direct services. So those are a few of the community partners that seem inherent to us in this integration model. While we've not yet fully transitioned to an integrated model for community impact, it certainly helped us focus our priorities within our new strategic direction. I mentioned earlier that we feel as though we're prioritizing the right activities and the right strategies, but that those strategies are not as aligned and unified within our community impact framework as we'd like for them to be. So this integration opportunity is certainly pushing us to refine some of our impact strategies and incorporate them into a more unified and less siloed community impact framework. I think it's encouraging us to think differently about our approach to investment, moving away from our historic model of funding agencies and programs to taking different approaches and building in ways of operationalizing those approaches with consideration of the integration model. Being able to leverage our investment of resources in direct services and equally being able to invest our resources into care coordination or case management services, being able to commit our resources and invest in a place-based way with specific geographies and populations in mind. And it's most certainly guiding our thinking in the way that we work with community partners and other community systems and institutions. And finally, but not of any less importance, it's influencing the way that we are thinking about measurement and performance evaluation and accountability in our community impact.